In this video, we are going to see a new drug, Emicizumab, its storage, preparation and administration. Emicizumab is a bispecific factor 9A and factor 10 directed monoclonal antibody used for prophylaxis in severe hemophilia A with or without factor 8 inhibitor. About the drug, Emicizumab comes in 4 strengths which are color coded. 30 mg per ml is blue, 150 mg per ml is pink, 60 mg per 0.4 ml is green, 105 mg per 0.7 ml is brown. Do not mix Emicizumab vials of different concentrations. Discard if beyond expiry date and any unused drug left behind after administration. Storage. Store the drug at 2 to 8 degrees Celsius. Do not freeze, do not shake, and do not use if appears damaged. Store in its original carton protected from light. Take out from refrigerator only 15 minutes prior to administration. Dosage. Emicizumab injection is initially given as a loading dose 3 mg per kg as subcutaneous injection weekly for 4 weeks, followed by a maintenance dose which can be given in any of the following 3 regimens: 1.5 mg per kg weekly, or 3 mg per kg once in every 2 weeks, or 6 mg per kg once in every 4 weeks. Investigations prior to initiation of Emicizumab. Baseline investigations to be done prior to starting Emicizumab prophylaxis are complete blood count, renal and liver function test, LDH, D-dimer, reticulocyte count, anti-human and anti-porcine Bethesda assays. Materials provided for drug administration comes in 2 carton boxes. One carton contains Emicizumab vial and the other carton contains 2 syringes, 18 gauge transfer needle, 26 gauge injection needle and alcohol wipes. Let us now see how to prepare and administer the drug. Materials provided are Emicizumab injection vial, 1 ml glass bottle syringe, 3 ml plastic syringe, red colored 18 gauge transfer needle, grey hubbed 26 gauge injection needle, alcohol swab and sterile cotton. This is Emicizumab vial inside the carton box with storage information written on its side. Carefully remove the seal and open the box, which contains an information leaflet and a color-coded Emicizumab injection vial with clear fluid inside it. This is the information leaflet which you can refer to know the detailed informations regarding the indications, dosage, administration, adverse reactions to the drug, and precautions to be taken before administering the drug. There are 2 syringes provided with the pack. This is a 1 ml glass syringe which is used to administer injections up to 1 ml. And the other one is a plastic syringe of 3 ml which can be used to give injections above 1 ml. This is a red colored 18 gauge 1.5 inch transfer needle which is used to transfer the drug from the vial into the syringe for administration. And the pack is also provided with a grey hubbed 26 gauge half inch injection needle used for administering the drug to the patient. Before preparing the drug, you have to wash your hands thoroughly with soap and water, following the steps of hand wash. And you have to wear a pair of an appropriate sized sterile gloves. The drug and the materials needed for injection are removed from the pack and is kept on a sterile surface. An appropriate sized syringe is chosen and the other one is kept aside. Now take the drug, remove the cap and keep it on the surface. Take the alcohol swab and clean the surface of the vial through which we have to insert the transfer needle. Now take the glass syringe and the transfer needle and attach them with a clockwise twist. Pull the plunger of the needle to draw in an amount of air equivalent to the dose of the drug that you have to administer to the patient. Now, carefully remove the cap of the transfer needle. Keeping the vial on the flat surface, insert the transfer needle perpendicularly into the drug. Now turn the drug vial with the needle upside down so that the tip of the needle is above the drug level. Slowly inject air into the vacant space above the drug. This is for the ease of withdrawing the drug later into the syringe. Now slowly and carefully pull the needle out of the vial so that the tip of the needle is now within the drug. Slowly withdraw the drug into the syringe. Now you can see that a small column of air is there at the tip of the syringe. Also closely look for any air bubbles stuck onto the wall of the syringe. Carefully, the syringe is tapped to dislodge the bubbles to the top of the syringe. Then reinsert the needle and push the plunger till you see the drug at the tip of the needle. By now, you will have pushed in the entire air in the syringe to the vacant space in the vial. Then repeat the procedure till you have the required amount of drug in the syringe. Now that we have transferred the required amount of drug into the syringe, recap the transfer needle by scooping up the needle cover. Then remove the transfer needle by anti-clockwise twisting movement and attach the injection needle with a clockwise twisting movement. Injection sites. Emicizumab is administered as subcutaneous injection. And as shown in the image here, the site for injection can be chosen between upper arm, thigh or abdomen. The maximum dose you can give at a particular site is 1.5 ml. And you have to rotate injection sites during subsequent injections. After injection, do not rub the injection site. Press with a sterile cotton for at least 10 seconds and apply ice pack if bruising is noticed at the injection site. To administer the drug, clean the injection site with spirit in a circular motion. Take the loaded syringe and carefully remove the needle cap. Administer the injection after making a pinch of skin between the thumb and the index finger and prick at an angle of 45 to 90 degrees to the skin surface so that it is inserted into the subcutaneous plane. Slowly inject the drug into the tissue and remove the needle. Apply pressure over the site for at least 10 seconds. Discard the syringe in the shops. After the injection, remove the label attached on the surface of the vial, which contains the batch number and strength of the drug, and is attached in the book of the patient. If a dose of emicizumab is missed, no need to make up for that missed dose. There are no any non-contraindications for emicizumab injection, and adverse reaction can occur in 10% cases, which include injection site reactions, headache, or arthralgia. There have been reports regarding thrombotic events occurring in patients who received emicizumab when a cumulative dose of more than 100 international units per kg of FEBA is given in prior 24 hours. Therefore, bypassing agents FEBA and Novo7 must be stopped at least 24 hours prior to emicizumab administration. And in case of any symptoms suggestive of a thrombotic event occur, then emicizumab is suspended till symptoms settle down. Laboratory investigations. No clinically significant antibodies have been shown to develop against emicizumab. While on emicizumab, bovale reagent chromogenic assay have to be done to get a true value of factor VIII inhibitor rather than doing clot-based assay. APTT-based assays including factor VIII assay will yield only misleading results with falsely shortened APTT and elevated factor VIII levels. Regarding the management of bleeds that occur during emicizumab prophylaxis period. If non-severe mucosal bleeds occur, tranexamic acid alone may be sufficient. In case of severe bleeds, Novo7, recombinant factor 7A is the first line of choice. If Novo7 fails, that is, no hemostasis attained even with 90 microgram per kg of Novo7 injection too hourly, and factor VIII inhibitor titer is low, factor VIII can be used. If inhibitor titer is high and all other treatment modalities fail, FIBA is the treatment of choice at a dose of 25 units per kg. Thanks for watching. Video prepared by Department of Pediatrics, Government Medical College, Thrissur.